Today on Scouted, we're stopping by Our City Eye Care to learn about how two local doctors are using innovative ways to treat their patients and the community. I'm Dawn Pompelli, editor-owner of the Scout Guide Huntsville, and this is Scouted. Today we're at Our City Eye Care with Dr. Alana Coker and Dr. Rica McRoy. Thanks so much for having me here today.
Of course, we're glad to have you.
The first thing that really touched me about your practice was your concept of Our City Eye Care. Tell me a little bit about that.
So our name is actually a play on words. Our City Eye Care stands for Our City Eye Care. And so in establishing our practice, it was really fun to be able to dream of ways that we could help support our community beyond the walls of an optometric practice. It is in part 10 community partnerships with local not-for-profits. Throughout our office, you'll see banners that represent these tangible partnerships. Also, every frame company is making a contribution to making the world better, whether that be with Arbor that plants a tree for every frame that's purchased, or One for One that enables us to be able to give away the exact quality frame that you purchased right back here in our community. But if it weren't for our patient community, we wouldn't be able to do those things.
Alana, you talked to me about personalized care. What does that mean to you at Our City?
So at Our City Eye Care, we truly are a local private practice. And so in addition to how we see the patient, eyewear is something that we personalize as well. So we have the option here of something called an eyescription. And that is through Zeiss, who we partner with for lenses. And so what they have allowed us to do is take a traditional prescription, which is written in quarter increments, and take that down to hundredths. So we can truly customize a prescription to exactly what a patient needs.
If there's one thing that people complain about when they go to the eye doctor, it's dilation. But I understand at Our City, that's not a necessity.
Yes, so historically the way that we as optometrists have screened the retina was through something we call routine dilation. So every time a patient would come, we would dilate the pupils to be able to take a look at the back of the eye. But now we have an alternative to screening the retina, where we can take a wide field image of the back of the eye. It doesn't mean we never dilate. There are still times where it is indicated for your eye health that we do that, but we don't have to do it as frequently.
You surprised me with a little bit of information. Tell us more about the age a child should be for its first exam.
You know, kind of the first eye exam should be around 6 months old. That's what our national organizations recommend. And so we participate in a program called Infant C, which helps direct parents of children to be able to come to our practice and get an eye exam at no cost to them. And so we volunteer to be a part of that program and treat those children if they're needed.
So there are a lot of people out there watching right now who are thinking, my eyesight's fine. Why do I need to go to the eye doctor?
Yes, absolutely. I think we could do better as a vocation. Our friends in dentistry do awesome in educating us about the importance of prophylactic care. We go to the dentist twice a year, whether we have a cavity or not. And so we only have two eyes, and most people, I think, would agree that vision is precious. And so even if you have really good clarity of sight, and perhaps you only need over-the-counter readers, it's still a good idea to have a comprehensive eye exam on a regular basis to be proactive and preventative with your eye health.
Alana, Rica, thank you so much for having me here. I learned a lot today.
We always love seeing you. Thanks for stopping by.
To learn more about Our City Eye Care or how to live well locally, visit our website at the Scout Guide Huntsville.